Friends, this is a story of around 10-11 years back from my life. I was a student in the surgery department, just started in the department, and I was on call at night. One day I got a call from the hospital that there is an elderly woman who has been brought by her son. She had a fall at her home and she has suffered some fracture and injury over the left arm. So you please come and attend to the patient. The son is a very big railway officer. He has some huge post. So I immediately ran to the casualty. I already spoke with my senior on the way, and he said that it will take some time for him to reach because he was out of Mumbai with his family, and he will take around 2.5 hours to reach Mumbai. So I said I will attend to the patient and let you know what the condition is. I reached the place, and sure enough, it was an elderly woman. She had sustained a fracture, the bone was coming out of her hand, and there was some bleeding. There was some skin that had torn up, and she had some bruises over her forehead also. So I immediately went to her son and asked him that what happened, how did she get a fall at home? So he said, and who are you? I said that I am the surgical resident here. I am the first year and my senior is on his way. So just give me a fair idea so that I can start the treatment and inform my senior. So he said that it's okay, you just do your work, do the first aid treatment or whatever is required for the wound, and I will speak to the senior when he comes. So respecting his wishes, I went to the patient. With the help of an orthopedician friend, we repaired the fracture, repaired the skin, and then put a cast over her hand to support it. Meanwhile, we also talked with the elderly woman. That lady was such a wonderful person. She was very polite and courteous to us. She told us that she doesn't remember much, but probably she felt some dizziness and sort of blackout before she forgot everything. So we again tried to approach that son who was a big railway officer, and we again asked him that, sir, please let us know as to how the events transpired so that we know what kind of injury she might have apart from this fracture, and we can do some necessary tests or investigations to support it. Again, he was not very keen to talk with us. He said that, see, she has a fracture, she has some minor wounds on her forehead. I don't think that she has any other major issue. So I will just speak with your senior. You did your work, now you can go. So we went out thinking that there is not much more than that we can do. Probably 2.5 hours later, our senior came. We had already did all this for 1.5 hours, so probably an hour later he came. And when he came, he went to meet that railway officer and asked him that how the events occurred. Because he was the senior, the officer was a bit humble and polite towards him. He told him that she had gone to the bathroom probably, and we heard a loud noise. When we went there, she had fallen down. She did say that she felt some dizziness or some sort of a blackout before falling down. And this is not the single episode. She has had similar blackout events twice or thrice in the past. So that immediately raised concern in our minds that this is a recurring event, so there is some issue which is causing her to lose balance again and again. So then my senior ordered an MRI, and sure enough we found that a part of her brain was not getting blood supply properly. Luckily the patient was okay, the problem was not severe, and we could just start medications with the guidance of a neurologist, and the patient did not have any other further episodes. These episodes are known as transient ischemic attacks, which generally last for less than 24 hours. But the thing is, we did not know that it is a TIA. Probably that patient might have had a big stroke, and if not treated in time, would have had permanent paralysis. Because of her son's ego, he did not share it with us, and had the condition been worse than what it was, we would have lost important golden time to save the patient from such mishaps. So, what we learn from this story is, number one, that whatever caliber of a person you are, whatever you have achieved in your life, probably the next person standing to you might be better in some other areas of life. So you should always respectfully approach other people, be humble, be polite, remember your roots, and speak with them on an equal term. The second thing is, whenever you go to a doctor, the history is extremely important. Lot of the times, because of a peculiar history or some significant point in your history, the treatment line changes, the test to be done, all that changes, and the whole diagnosis in the minds of the doctor changes. So the history is very important. Whenever you visit a doctor, you have to be as detailed as possible to describe how the complaint started, what started first, what started next, how long it went on, and so on. The more detailed history you give to the doctor, the easier it becomes to clinch a diagnosis and start proper treatment.